Growing up, my grandfather was actually a primary care doctor. I spent a lot of time with him and seeing the care that he provided to his patients. It was more than just a job. It really was what I would call a vocation. Hi, I'm Dr. Krysta Contino, a gastroenterologist here at Cooper University Healthcare. I'm also an assistant professor of medicine at Cooper Medical School of Rowan University. The most important thing to me is really trying to build a relationship with my patients off the bat because they are very sensitive issues. I think being able to really develop that rapport with your patient from the beginning and build really a relationship of trust, I think, is the most important thing. People are coming to you because they're their most vulnerable state, and you want to be able to make sure that you're providing them with that feeling of security, so to speak. So I really do like to make sure that, number one, we first develop a trusting relationship really with an open communication. Obesity is obviously a major problem in this country right now. I actually went on to do a certification, a fellowship in obesity medicine, which is a newer field. We use a lot of medications to treat obesity in addition to lifestyle modifications. You really can prevent and even help to treat some of the downstream effects and some of the comorbidities, so to speak, that go along with obesity. So it is very important, and because that is something that is somewhat of a sensitive topic too, it kind of goes back to my whole philosophy and mindset of really being able to build that relationship and making sure that people trust you too. I'll say I'm a Cooper lifer. And they asked me where I wanted to retire, and I said Cooper. So having done training here, and I think it's a really, really special place. We have a very collegial atmosphere as well, meaning that different members of different departments work together. So for example, if I have a patient that has a particular condition that I know needs to see another specialist or another team member, I'm able to reach out to them, and we have a great working relationship, being able to really make sure that we help facilitate the care that patient needs. I think, when you are able to leave the office and know that you helped somebody that day, I think that to me is, the holy grail, if you will. You know that you went in, you tried your best, you did whatever you could to help that patient, and that you've actually been able to do so.